Are healthcare insurance costs about to spike? Let's find out. I'm Brooke from MWEG. Each week we pick a news story to practice some media literacy basics. Today we're looking at a collection of claims from politicians about the impending decision on whether or not to extend COVID-19 era tax credits that make Affordable Care Act plans more affordable. If the credits are not extended, they will expire at the end of the year. Republicans and Democrats have both expressed concerns over the issue. First, let's stop. This is a big story that could impact a lot of people, so it's important to get more information. To investigate the source, we can see that all of these comments are coming from politicians on X, who have their own political biases. So let's look for news articles that are less biased. To find more coverage, we can look at this article from USA Today that says a health policy nonprofit estimates 22 million Americans who get Obamacare tax credits will see their monthly premiums more than double on average. This does not mean the price tag on the Affordable Care Act is doubling, but without the add-on subsidies, consumers will pay $1,016 more on average in 2026. The amount of increase in premium costs is dependent on consumers' age, income, place of residency, and coverage level. If the subsidies expire as planned, the ACA price will revert back to its original levels as outlined in the 2010 law passed under President Obama. Originally, tax credits to offset the cost of insurance were meant for those who make less than 4 times the federal poverty level, but Congress made the subsidies available to more Americans during the COVID-19 pandemic. If the subsidies expire at the end of the year, then those who earn more than 4 times the federal poverty level, which is $62,600 for an individual and $128,600 for a family of 4, will have to pay full price. Healthcare costs are increasing because insurers will be raising rates by 26% on average in 2026. The article also says as many as 4.2 million Americans are likely to drop ACA coverage if the subsidies expire. This article from the BBC cites a couple from Utah that says they currently pay $495 a month for health insurance, but without the subsidies, will be paying about $2,168, which is a 338% increase. Finally, let's try to trace this information back to the original source. We can see in the Inflation Reduction Act of 2022 that the subsidies were increased for more households and are set to expire at the end of 2025. So is it true healthcare insurance costs are about to spike? If the subsidies are not extended, then yes. Those who get healthcare through the Affordable Care Act marketplace, such as small business owners, will be seeing a large spike in their monthly cost. For more media literacy content, subscribe to our free weekly news roundup.